Hi guys! Alright, wait. I need to chill. I need to get myself together. I need to chill. So, hi guys. Hi guys, welcome back to my YouTube channel. It's your girl, Dr Ifedayo, bringing you tips on how to succeed in medical school, how to get into medical school, how to stay in medical school, and get out of medical school successfully. It's been a hot minute because I have been trying to maintain my mental health. A lot of things have been going on, but that's not for this video. Let's just jump right into it. Today we're going to be talking about 5 ways to successfully scale through first clinical year. So first clinical year will be your first year of clinical, basically. That's what it is. And I'll give you 2 extra points on how I think you can successfully scale through first clinical year. That will be like I think fourth year, new GMS. In other schools, I don't know what year it is, but what I know is first clinical year is 12. It is the transition. Wait, whew, it's the transition between your basics, where you do a lot of studying and you see the efforts of your studying, to actual clinical years, where you actually have to apply all you've studied into the patient in front of you. Although you're going to be guided, like a lot of us were. Lecturers will be there, residents will be there, house officers will be there, but it is still not the same. Like like um like if you were in final year and you've done it for a few years, that's what I'm saying. It's still like it's not the same as basic science. It's never the same, never ever the same, and it's not the same as your internship you did over the summer or something. So yeah, let's get into the first point on how I think you can scale through first clinical successfully. It's a very hard. It's a very, it's a very. I'm actually not going to edit all this out because I want it to be pure, raw. This is me, the happiest I've been on camera in a minute. But anyways, it's a very highly requested video, and let's get into it. So step number one will be, yes, I'm looking at a book. Everyone's confused. At least for the first 2 to 3 months, everyone is just as confused as you are. So don't fret. You're in good company. Everyone is damn confused. So go to lectures. Do those end of blocks eyes. Do those end of rotations. If you don't pass it too much, don't be perturbed, right? Everyone is confused. Everyone is trying to figure it out. Everyone is trying to figure out the schedule, the timing, how to sleep, how to study. It's a whole change from just studying a lot to like now studying to apply to a patient and asking the right question. It's not like you've been taking history the whole time. It's very new. So everyone is confused, okay? Just settle in. And if you're not still settling after the third month, don't worry. You still got time because the second tip is going to help you. So the second one is attend lectures, like I just said, do past questions and practice. Practice with the OSCE guys. I think a lot of schools have moved to the point where the clinical exams is via OSCE, right? And they give a guide usually. Practice with the OSCE guide. I think practicing at least 4 days of the week, at least twice a day of those days will make it easy for you. Because if you know how to go through the motion, very soon you start asking your question yourself. So why am I standing at the foot end of the bed? So what does it mean? What does it mean? What conditions will actually give me a puffy face? Oh, so what conditions will I have in my mind if I see a jaundice patient? Oh, what conditions will I have in my mind if someone is in respiratory distress? How do I know someone's in respiratory distress? Oh, there's flaring of LNAC, there's this, you see, there are different things that will now be popping through your mind, and that will now help you appreciate the art, the science, the whatever you've been studying. So the more you practice, the more questions pop up in your head. But if you're just reading, you're not trying to apply it, and then it's be like, what am I even studying? Nothing makes sense. That it's not going to make sense. And remember, your clinical is actually, you have to pass your clinical to move on. So you need to actually pass the clinical. So you have to practice the OSCE, practice. Okay, good. Now the third one is it will all make sense in final year. I'm sorry to break this news to you. You may even end up passing first clinical, moving on to the next year, and it won't make sense. It won't make sense in that you're still trying to connect one. So I'm not saying you won't understand anything. You should understand. You should understand the basics. You should understand how to get the history and get a diagnosis. You should understand you know, why history is important, if anything, and why a clinical examination is important, if anything. You should understand that. Okay, good. But it will all make sense. It all tying together in your final year. You see, When you get to your final year, you're going to understand why you did this in obs and gynae, you did this in pediatrics, you did this in medicine, junior clerkship, you did this in surgery, junior clerkship, why you did this in ophthalmology. It's all going to make sense when you see a human being right in front of you and you realize that this person just doesn't have one problem. They have so many problems altogether. So I think in first clinical, it feels like you're separating into systems, and that's how the OSCE system kind of works. Because in the real life, as as a doctor that is working, yeah, I've realized that one person doesn't have just one problem, and that is what your lecturers will try to tell you. That's why you need to get everything all together, and it all makes sense more in final year because you got a human being now, not just systems. Good. Now that I have your attention, let's move on to the 4 points. So yeah, the last one I said is focus on getting a diagnosis first, then aim higher, like the investigations and all that. You see, the basic they want you to know how to do in the first clinical is to be able to ask questions and not to get a diagnosis. Do a clinical exam to support what you're thinking in your head. Be able to get at least 3, 4, 5 differentials. You get what I'm saying? Yeah, and they want you to take a broad history because when you start working, again, you're going to take more focused histories. When you get to find out, you're going to take more focused histories because now they believe, okay, now you know how to differentiate this from this. Now they want you to be able to know that this particular symptom can be as a result of 10, 15 different things. When you get to find out, they want you to know that this symptom plus this other symptoms means this. Okay, so take like surgical jaundice. When you get if it's intermittent, if it's progressive, if it is fluctuating, you see the different differentials that's going on in your head. Meanwhile, in first clinical, they want you to know that surgical jaundice can be caused by that. List everything. If you can go ahead to differentiate it, that's a plus for you. But in final year, if you're only telling us that surgical jaundice is as a result of and you're listing all 5, 6, 7 of them, then you have a problem because you should be able to say fluctuating jaundice with the presence of this is in this age range is this. But sickle cell plus this, you see, you're supposed to be able to tie everything in together. So in final, you're supposed to take a more focused history, which is what you'll be doing anyway as a house officer, as an MO, and what's not. Anyways, let's move on. Number 4, the 4th tip is you will cry. Oh, I promise you, you're gonna cry. I assure you, you're gonna cry. You're gonna break down in tears. Macho man, strong man, nigga. You are going to cry. You are going to cry, okay? And guess what? It's okay. It's really okay. But you know what? After 1 hour of crying, just sit down in front of your computer and start studying. If you can't study, watch an academic video because time waits for no man. It's okay to feel down, but the problem is if you feel down and you don't want to get up, now that's when we're going to have a problem. You don't stay down. Okay, we're fighters. What I say, we are, you know what? Let's just type in a comment down there. We are fighters. We do not stay down. We do not stay defeated. We get up again. Okay? So it's okay. Pick up a book, pick up a video, YouTube, whatever it is, they're going to make you feel good. Just pick you up and get going. Get up on the horse all over again. The 5th point is you need to have an outlet. You need to have a very balanced life. You need to have an outlet where you can just pour yourself into when you're feeling like, I need to escape from this. And I think it's even worse for those who live on campus because it doesn't feel like they're leaving school. They're leaving a particular situation or an environment. I live off campus and I feel like whenever I left school, I'm like, I've left. And let me face what is happening. Let me face the different environment or scenario that is in my house. But if you live on campus, it's a bit like you're still seeing the same classmates, everybody's trying to study, is choking, you're feeling more and more choked up. I'm not saying because of that you stay off campus, but you should find an outlet. Some people just decide that, oh, I'm going to go karaoke singing. I've had it. Go. Some people decide that they want to have boyfriends or be in relationships rather, or have partners. And then you know what, I'm going to see my partner. We're just going to watch a movie, go to the cinemas or something. Oh, I'm just going to pray. Some people decide that they want to pray. Some people say I'm just going to go to church and just let it all loose. Some people just say, you know what, I'm going to see a movie by myself. Just do something. I'm going to cook. Just have an outlet. But the main thing is don't let that outlet distract you from getting the main goal. If your outlet is now like you're doing your outlet 9 out of 10 times, and you're studying for every 9 time you go out to use your outlet, you're studying 1 time. Then that's not an outlet. That's a distraction. Okay, you need to balance it. So for every 9 times you study and you feel like okay, then the 1 time you go use out your outlet. So yeah, those are my 5 basic tips. Oh, I promised you 2 more. Let's flip the page. Okay. Okay. So the sixth one is don't walk alone. The truth is, be a Liverpool FC person right now. Don't walk alone. Truth of the matter is that medical school you can't do all by yourself. Once you decide to have a career in medicine, you can't do it by yourself. You need help. You need help from either the what's it called, the allied health sciences people or whatever. But as a medical student, don't walk alone. Don't think you can figure out by yourself. You can't read the whole syllabus yourself. I'm sorry to say, no matter how smart you are, you cannot read the whole thing yourself. So don't walk alone. Someone is going to say your group study is going to help you. Okay? I'm not asking you to like, oh, go and be best of friends, have a clique or whatever. If you're not that kind of person, it's okay. Just join a group that is very well rounded. Don't if you're a graduate entry student, don't say I'm only going to work with graduate entry students. If you're a regular student, don't say I'm only going to work with regular students. No, don't do that. It's not going to help. Join a very well-rounded group. Don't say all of us are doing medicine, so we're only going to do medicine. All of us are doing surgery, so we're going to be a surgery. No, it's not going to help. Have a mixed group and discuss things. Okay, do past questions, do the OSCE examinations, all that. You learn something from this person's flaw, from that person's flaw. They will learn from you as well, and that way you are getting skills. You're getting knowledge that you are really not going to get if you sat down by yourself alone reading 24 hours a day. You see what I'm saying? So, yeah, don't be isolated. If you want to go far, go alone. But fast, go, sorry, if you want to go fast, go alone. But if you want to go far, go with people. So, really, you can go so fast and realize that you just gather dust. But if you go like, far and realize that you've gotten stuff, then you have to go with people. Okay? Now the last tip for me is make mistakes. Okay. Make mistakes. But the only place you are not allowed to make mistakes is the exam hall. You're not allowed to make mistake in the exam hall. Make mistake on the word, make mistake during group studies, make mistake when you're asking your consultant's question, look stupid to your resident, look like an absolute empty-headed person to your classmates, because that is the time to make the mistake. And don't be apologetic for it. If you don't know it, don't be apologetic for it. You just don't know. It's not your fault. If you knew, you will not be there trying to get knowledge. So don't be apologetic for making mistakes. One place you should not make mistake is the exam hall. And peradventure you make a mistake in the exam hall, the next time you have the opportunity to prove that you know, do not make that same mistake. Do not let your nerves get the best of you. You see, I personally had a problem with my nerves in first clinicals, and then I promise you, it never had the best of me in any exam. I mean, I was scared, anxious, and all of that, but I told myself, girl, Ifedayo, this is the only chance you have to prove that you've been serious throughout the year. And nobody's going to believe your story that you've been serious if you can't prove to them. Like the exam is just a point of you. It's a point. It's a time for you to prove that you've been serious, that you deserve to move forward. You should not give them a reason for them to say, you know what, stay backwards or stay back, or try to rewrite the exam or whatever. And if you have to rewrite the exam, it's not the end of the world. It's an opportunity to learn it and master your craft and be way better. Because the person that did it first time probably just got in with a stroke of luck. Now it's time for you to even know it and master it, and then not just go with a stroke of luck, but get it. You know what I'm saying? Like get it. So yeah, that ends my tips for crushing your first clinical year. And it actually kind of applies to all clinical years because, quite frankly, anything junior clerkship, you need all the help, all the grades and confidence and whatever to build you up. So I'm going to say to you all, congratulations for smashing it thus far. Sorry the video came late. I'm sure to still help one or two people. And if it's like 1 week, sorry, 1 month to your exams and you're just saying it's not too late. Instead of studying and practicing 4 times a week, 4 days a week, you make your own every day a week, okay? And then put in your best. It means that you're not going to sleep. You have to deny yourself all the pleasures you've afforded yourself earlier on. See, this medical school, there's no formula to it. The formula is the one you apply for yourself and works for you. I wish you all the best. And if you see me on the wards, the hospital, say hi. I've seen a couple of people, I say hi to them. And then I'm looking stressed. It is the work. But I'm so happy. I'm so happy. I'm in a better place mentally. My skin is glowing, even if I'm still working. It's a work in progress. Follow my Instagram and follow my skincare journey, okay? And subscribe to my channel. Give this video a very big thumbs up, and do not forget to write down below. We are conquerors. Or what's that? What I said? yeah, we will get up or something. No, just comment that thing I said, Jerry. I forgot what I said. But yeah, what I know is I didn't give you shit advice and you thank me for this. All right then. Bye.